What's your working mix like?
I do mostly smile makeovers, so predominantly Invisalign, composite bonding, and then during maternity I did Invisalign.
Wow.
Um,
Did you always know that this was the route you're going to take? Welcome, guys, to another episode. Today, we've got a phenomenal guest, somebody that I've known for a few years now. We met at an Invisalign event where Dr. Gala had come to speak to Apex providers, and she's doing some amazing work, ortho-restorative. If you look on her page, she's doing some stunning cases. I mean, if dentists were musicians, she would be releasing hits all the time, because I'm always, looking at the work she's putting out, and it's just stunning work, smile makeovers. So I'm really excited to have Dr. Shivani Sharma with us today. Thank you for being with us today.
it's a pleasure. Thank you for having me.
So just let us into your week. What's your week like in terms of family life, work life? How is it going for you?
So in terms of my daily sort of my usual week life, it's quite hectic, I would say. I've got a son who's 7 years old, and my life pretty much revolves around him and work. And I work 5 days a week. I do one Saturday a month. I have recently dropped one of my Saturdays because I just found it was taking too much time into my personal life. So I do 5 days of work. Most days I do 9 till 3, and I do 2 days 9 till 8. So it's pretty full on.
And what's the type of dentistry you'd say you're doing? Is it exclusively smile makeovers? Is it some other aspects of dentistry? What's your working mix like?
Yep. So I do mostly smile makeovers. So predominantly Invisalign, composite bonding. We do the occasionals like porcelain veneer case as well. So that's pretty much what I focus on at the moment.
Yeah. And if you don't mind sharing, whereabouts did you qualify, and how long ago since you qualified?
Qualified in Leeds University, and back in 2015. Sound like a dinosaur.
Not at all. And I'd say it probably hasn't. It doesn't look like it's aged you at all, having qualified back there. Did you always know that this was the route you're going to take within dentistry, or did this develop over time?
I'd say it definitely developed over time. So when I was doing A level, my favourite subject was actually maths, and my focus was maths, and that's kind of what I wanted to do at university. But my parents, being Asian, they didn't really understand what I would do with a maths degree at the time. So they suggested that I'd look into more of a professional career. So I did this course called MedLink. I was thinking about doing medicine, but it put me off just the way doctors work, what they have to see in a daily, their hours. And then my mum's friend is a cosmetic dentist, and I did work experience with him, and I instantly just got like a spark for it, and I started to get a lot interested in dentistry. He was very glamorous, he had a Ferrari at the time, so I think just looking at him, and I was like, wow. And the way he worked, what he was able to create, his whole lifestyle, I just thought, this is something that I want to do. It just looks amazing. So then I did some more work experience, did some general dentistry. I think at the time it was a lot easier to do work experience, I'd say, than it is nowadays.
Yeah.
But then, yeah, the rest is kind of history. I kind of went into dental school. I didn't At dental school. I wouldn't say I was the most academic.
Mm.
I but I got through it. I got the degree, and then really it was I did my vocational training. I worked as an NHS dentist for a good sort of 4 to 5 years. But then once I became a good sort of all-round dentist, once I felt comfortable in this sort of general dentistry, I started to do more courses.
Yeah.
And I've always had an interest. So since I saw this cosmetic dentist, even throughout uni, I've always had an interest in the cosmetic side. So I started to do a couple of courses. And yeah, and then the more I did, um, looked into cosmetic dentistry and, and did more courses, the more I started to get a passion for it.
Yeah. And would you say that going into aligners came after the restorative, or did ortho come first, then restorative? How did that come about?
Probably restorative first. So I did this year-long course with it was Dr. Ian Klein. So this was probably around 2018, and it was called Cosmetic Dental Seminars at the time. And that was just your foundation sort of cosmetic dentistry. So it was all about photography, the proportions of your smile, the restorative aspect, crowns, inlays, onlays. It covered sort of your general sort of cosmetic dentistry. So I did go into the restorative side first. And then I got married, had a baby, and that took out probably a good sort of 3 years. I sort of took a step back from my career at that stage. And then during maternity, I did Invisalign.
Oh, wow.
And then Invisalign opened up a lot more doors for me. And that's how I've kind of, then I started doing the align, bleach and bonding cases. And I'd say that's definitely my niche. I absolutely love doing those cases.
Would you say that you've always been a confident person in trying new things? Because what I find is that transition from NHS to now doing private work, a lot of people doubt whether they can actually be that type of dentist who provides quality private work. And then there's also the barrier to doing cosmetic cases, because people see a lot of, I guess, negatives in stepping into doing smile makeovers, and then even doing aligners during your maternity. A lot of people think, this is probably not the best time for me to do something new because I'm not actively practicing. So, do you find that you've always been a confident person to try new things? How have you overcome those barriers time after time?
Yeah, I think I've always been sort of I've been confident in myself, growing up. But in terms of dentistry, things like that, yeah, definitely it's taken time, to get to where I am. I think even the general dentistry, it took time for me to really build my confidence, and especially with Invisalign. So I remember I did my course and I started working 2 days a week. I didn't like bringing up the subject of Invisalign, even though I'd done the course. I didn't talk about Invisalign to my patients. And then I contacted the local area rep for Invisalign, and I said, how do I want to do it? How do I do it? And they were really supportive. They organised an open day within the practice that I worked at, and from there I remember got 2 patients, and then luckily they were simple cases. So that was my thing, that I started off doing simple cases, and luckily it went really well. and I was actually amazed. I remember when I did my first two cases that I was able to create such a difference.
Yeah.
And touch wood, my patients were both so they were very easy to work with, and just seeing how it made them feel really kind of boosted my confidence. But even it took time, and then I moved to a different practice, did a few more, I started advertising more, um, did a few more cases. I think I did 10 in the next year. So I probably did 2 the first year, 10 the next year. Um, and then I did a postgraduate diploma in clear aligner therapy, and just kind of understanding. So the one I did was with Dr. Raman Orlak, the safe clear aligner
Which
therapy.
cohort?
I can't remember that. I think it was because I remember I started in one, and I wasn't able to keep up. So then I went back. So I kind of lost track. I think I
Okay.
can't. Maybe I'm 6. I should
All right,
know.
because I'm cohort 8, um, so that's why I was just asking.
8. So maybe I was, yeah, maybe I was 6. But yeah, amazing course, amazing teachers, and they teach you a structure in terms of Invisalign. So they call it like the safe kind of way of, planning a case. They teach you the biomechanics, and I think just understanding that really helped boost my confidence. So I think experience and knowledge. And
Yeah.
in terms of experience, I feel it's really important to start off with simple cases, because a negative experience can really put you off. And I think it does take time to kind of um, start to understand what type of patients are going to be easier to work with. But, the ones I chose to work with to start with were ideal. They really helped. They gave video testimonials. They were so complimentary. And then they recommended me. So I think, yeah, it kind of went from there, and then word of mouth. And yeah, as I did more cases, my confidence grew, basically. So it didn't just come. I think not many people are born good at something.
Yeah.
Most people have to work at it. So for me, it was definitely something I worked at, and because I had a passion for it, and I had good experiences, it kind of grew. Confidence grew from there.
Was it difficult getting yourself to say, right, I'm gonna do these first 2 cases? Because I hear that a lot of providers never actually start a case. So for you, was
Yeah.
it just, I've now got this accreditation, I've asked this provider, this rep to help me out, we've set an open date, I'm gonna do it. How was it? What was going through your mind around that time you started with those 2 cases?
So my first patient was lovely. He was getting married. It was so easygoing, which definitely helped. Um, but it was a bit nerve wracking. But I remember we were taking molds impressions at the time, and I had to, I think, do it twice to get it right. But I followed the protocols they gave me, which were quite straightforward with Invisalign. It was just a case of taking them all, sending them off, and then you get a click and taking the photos, and they have an app you can do it through your phone, and then the clean checks there. And at the time, I didn't really make. Now every case, I make some kind of amendments, because I'm thinking of what I want it to look like with the restorative. But it's pretty straightforward. The aligners came, put the attachments on, so I felt like it was quite doable, actually. So I
Yeah.
didn't feel I was definitely out of my comfort zone, but I was able to do it, if that makes
Yeah.
sense. It was a
Yeah.
bit daunting, but I kind of threw myself into it, and seeing the process of it was quite uplifting. Like, wow, like this, I think when you see a clean check for the first time, it is pretty wow, isn't
Yeah.
it? You know, like, wow,
Yeah.
I'm seeing week by week how these teeth are going to move. You know, this is amazing.
Yeah. I think back to my first few cases, and the great thing about using a cloud-based system like an Invisalign is you can go back to your first ever case and see how you planned it out. And it's a little bit cringeworthy because I was just looking at my instructions and it was like, please align top
Yeah,
teeth, please align bottom teeth, send.
yeah, yeah.
So, um, what would you say to yourself if you were looking back and trying to guide yourself on those first two cases? Would there be some changes to how you approached it?
Absolutely. And even the result, you know, like that was my first bonding case as well. So my first Invisalign case was my first bonding case. And if I were to kind of bring those photos up now, then they don't look anything like the kind of work I do now, you know. And looking back, I find like the work I did quite cringy, and there's so many things that I would do to change what I did, but I don't regret any of it because it was all part of the learning, you know. And yeah, even like 2 years back, I look at some case and I think, oh, that wasn't great. So I
Yeah.
feel like I'm always, I think you're always kind of, if when you look back at those cases and look at, you know, photography, as you'll probably agree, is so key, isn't it, to progression? I, I
I
find
think
that
that
anyway.
that's
Um,
it. As you're
so isn't it to
progressing,
look back? Yeah,
as you're progressing, you're gonna look back at your
yeah.
previous work and see areas of improvement. So I would say if your first few cases are not cringeworthy, then there's something wrong because maybe you haven't been progressing, you know.
Yeah,
Um,
very
and
cringy.
it's probably a fact that you have to face that your first few cases are going to be your worst cases, and that's just a fact. So that shouldn't put you
But they
off.
might work compared to somebody else. You know, like they could be. It's. I think everyone's got their own journey.
Yeah.
Yeah, and I think that's the main thing, and to kind of delve into it and not worry. You know, as long as the patient was over the moon. You know, the patient was so happy with what I did, even though I know, like it wasn't that I felt it wasn't great. But you know, and I think that's the main thing.
What would you say then changed from you doing two cases to then doing 10 cases? What was the big difference there?
So I think definitely changing the practice. So I worked in it was a practice. It was a government building, and we only treated the um, employees, sorry, that were in the building. Um, so they all worked for the Department of Health and Pensions. So the age range was mostly sort of late 30s to 60.
Hmm.
So I found we did open days, but we weren't really getting much engagement. Um, so I switched practice, not just for that reason. It was more actually at the time for location because I had my son. But yeah, looking back, that definitely made a big difference because when I came to this practice, it was I was an NHS dentist, fully NHS. I
Hmm.
worked out of a box. I didn't have my own surgery, so I used to go between surgeries, whatever surgery I was put in, you know. Um, and I got these leaflets from Invisalign. They had this stand, you know, that old stand, that cardboard
Yeah.
Invisalign stand. I don't know if you ever used that, but I had it in the corner of my surgery. Or if I was in a different surgery, I put it in there. So use those kind of things to advertise it. We did an open day. That was key. And from the open day, we got like we had 7 patients, which was really good for my first open day here. And then I think they all went ahead. And then
Wow.
from there, with those patients, I invested a lot of, you know, I made sure that these were as best as I can, gave them great customer service, and then from there they recommended their friends and families, and through them I got more patients. And for me, that's how I've grown, word of mouth.
Yeah.
So yeah,
Yeah.
so that the 10 patients, you know, that transition was more just like advertisement.
Yeah.
And I'd say that was the main thing that helped me get those 10 patients at the time.
Yeah, I've never had everybody go ahead on an open day. I don't think I'm as welcoming and as warm as you.
No, there wasn't everyone. I think it was 7 out of 15. It was 7
Yeah,
out of 15 that went out ahead. But yeah, I think the way you speak to patients and the way you connect, I think as I'm kind of getting older, or as I'm getting more experience with dentistry, the more I'm kind of, you know, realizing how important that is, having that
mm,
connection with your patient, and just kind of looking at things from their side as well, and how what that means to them
yeah.
as well, having that connection with someone who's going to treat your teeth.
And what
Yeah.
made you persist with Invisalign? Because you know there are different brands out there, and one of the questions that dentists are always asking is, which is the best aligner provider to go with? Which is the cheapest? You know,
Uh,
which has got the best service? You know, what made Invisalign the right choice for you?
I think like the data at the time was, you know, I think that when I started, there weren't that many alternative aligner systems out there, not reputable, not as Invisalign. Invisalign was the main kind of clear aligner system. I think they still had their patent at the time when I first went into Invisalign,
Mm,
um, and then over time, there has been other aligner systems that have been offered to me. You know, especially with my dentist, they had a strong relationship with Straumann, um, and they had Clear Correct as well, which is a lot cheaper actually than Invisalign. But for me, it I think Invisalign has the most data behind it.
mm,
And if you look into the technology, it's a lot more advanced than your standard aligner systems.
yeah,
And I'd rather pay extra knowing I've got a better product, and it's, you know, and something that's more reliable. And that's just, I think that's a personal thing. So I know so many dentists that use Clear Correct, and their cases are great, and they're happy. So I think it's whatever works for you. And for me, that's how I feel about Invisalign. You know, I feel it's a reliable system,
yeah,
and it's got the most research behind it. So I'm quite, I like, I choose things on like how much evidence base there is behind it, you know, in terms of
yeah,
material, you know, and what works best in my hands. Yeah.
yeah. Now, over the time using, so for me, it was mainly that the person that I first started seeing doing using clear aligners was using Invisalign. So that's how I started with Invisalign, just because the
Okay.
person that
Yeah.
was mentoring me was using Invisalign. Um,
Right.
I've found that over time, I prefer the ortho, and I do restorative only because my patients really want the restorative part.
Yeah.
For you, would you say you like the ortho, you like the restorative? Which one do you like more, or is it equal for you?
Probably more ortho.
Yeah,
And what I always say to all my patients is, when it comes to composite bonding, you want to do as little as possible. That is, I say that to all my patients, you know, because it requires maintenance. But you know, nowadays, because of social media, you know, Instagram, everyone wants to look as perfect as possible. So
mm,
they want a perfect smile, and sometimes just aligning teeth on its own doesn't, you know, doesn't give you that perfect look. So I think I always show patients their treatment plan, and we kind of discuss it from there. You know, if there's a shape discrepancy or one edge is worn, then I say to them, you can do composite bonding on that if you wanted, but there's maintenance.
Yeah.
So I am definitely more ortho, but most of my cases do end up having bonding as well, because people, when they come to me, want that kind of perfect look as well.
Yeah.
Yeah.
If someone is really into the restorative part and
Yeah.
is using ortho to help their restorative, what would be some tips you would give to making sure that your skill set lends itself to that? And how would you say it's best to communicate with these type of patients that want these type of smile makeovers? I mean, from your years of experience, what things have you picked up on which can help?
Yes, so I think definitely like the initial consultation is so important. I think kind of talking to the patient, just kind of getting a vibe of what they're like, you know. I think usually I can tell if a patient wants like a natural looking smile, or if they're going to want a fake looking smile. But yeah, asking them that question, you know, do you want them looking more natural? Do you want them like Hollywood look? Like we've got, so for me, I classify the Hollywood look as a wider smile, more square teeth, a more wider smile. And then I always say to patients, there's a fake looking teeth, which is like, you know, bright white, unnatural, blocky teeth. Then I kind of give them that. I say, where are you in that spectrum? So that's typically what I ask my patients, like, where are you in that spectrum? And then I think that helps them kind of understand what they want. And most patients that come to see me actually are between sort of natural and Hollywood. And that helps kind of understanding what look they want. Then also the treatment plan. So the clin check, when you see when I always go through the clin check with the patient. I know some dentists don't go through clin checks with patients, but I always go through it. And with most of my patients, it's just, yeah, that tooth is shorter. We could do it on that tooth, we could do front four, front six, and usually patients are happy with that. But sometimes if I feel like someone's very particular, I'll say, do you want me to draw it on for you? So what I'll do is a screenshot of the clin check. I'll make the background black, and I'll get my Apple pen and I'll just draw on, you know, the composite where I plan to do the composite, just to give them an idea. And I say, you can take a picture of this if you want. And that kind of helps them. There's also Smile Architect, which I haven't actually started using, but that is essentially for communicating, and also it's for like the DSD workflow as well. But yeah, that's also very useful to plan like ortho-restorative cases and communicate it to the patient. Sorry, I like to scum off.
That's okay.
But yeah, so yeah, so I'd say that's basically my way of kind of communicating with the patients. Sometimes I do a mock-up, a chairside mock-up. So like when the patient's finished Invisalign, we get them in for a review, and I actually put composite, so usually just flowable, on the edges of the teeth. And I say, is this the kind of what you want? And that also really helps. But that's it really. So, but I think communication is really important, and I think it's not just visibly showing them, but it's the kind of understanding them as well, and understanding what kind of look they like.
Yeah, no, that's really valuable there. The fact that you're taking your patient on a journey and making sure that they're fully consented and informed throughout the process, so that there's no big
Yeah.
surprises at the end, because that's one thing we don't want: big surprises.
No. And I think you get to understand the patients, don't you? Like some are a bit more anxious and they require more input, whereas some are like, just do it, you know. I trust you, just do it, or they don't want to know too much, and so I think there's different types of patients, and you do have to just tailor it. I find that I have to tailor it to according to my patients.
Yeah. You talked about going through the clean check with your patients. So just on a practical level, what are you doing? Are you bringing them in and then showing them the clean check? How are you doing that bit?
So most of so when COVID happened, after that they were all online. So we used to do Zoom, just like the share screen option in Zoom, and just go through it on there. Now we give patients the option to come in, and we've got a TV screen. So I put up the clean check on the TV screen. Some patients like that, coming in, discussing it in person. But we also offer the virtual as well. And I do sometimes do virtual, so we do both.
Nice.
Which
And in
you
terms,
do.
well, for me, I use Zoom, so I'll go through the clean check in detail, sharing screen on Zoom, and then what I'll do is I'll send it to the patient with some consent documents.
Yeah.
And then what happens is they've got a time period where they're looking at it, digesting the information. Then they can choose to come in and sort out consent documents, ask any further questions. And at that point, if they've still got questions, we can go into it in a bit more detail. If they're completely happy, we then process to start treatment. So I'm using Zoom to record a description of the clean check, attachments, IPR, whether we might need refinements. I'm going into all of that in the Zoom as my main bit of consent. Yeah.
And do you send the recording to the patient?
Yeah.
Yeah.
Yeah. So what we do is I send it to the practice WhatsApp. Then the practice WhatsApp sends it to the patient's WhatsApp with their consent documents, so it's easily accessible for them.
Yeah. No, that's great, and it's so important. The consent process is so important, isn't it? It
Yeah,
makes
100%.
the journey to be a lot smoother.
Yeah, and I've had to refine it over the years, because even little things like in the consent documents, I'd put you get whitening included, and then that bit me one time. It was just the one patient who was like, I want more whitening trays. No, more whitening gels. So I now put you get 4 whitening gels as part of this treatment. So you just pick up on certain things as you meet particular patients and just refine the process.
We say you get Phillips teeth whitening, you get 1 kit, but there's no guarantee as to how white your teeth went. That's also something which our patients said, I've done the Phillips, but I want them to be whiter. They had gone so white, but then we were like, oh, what do we do now? So we just gave them more syringes, and then since then we've clarified it, there's no guarantee, and obviously some areas whiten more than others. So I think whitening consent is its own thing, really, isn't it?
And these are things you gloss over at the beginning, but when you encounter the patient, it makes you rethink how you're actually presenting, your consent. You just add on to it.
Patient, she said she wanted her teeth to be. This was actually a veneer case. It wasn't a line bleach and bond case. But she said she wanted them to be the brightest possible. She showed me Katie Price's teeth. She said, "This is what I want my teeth to be like." So for me, that was BL1. So I made her some BL1 veneers, but there was a little bit of texture in there, and they weren't as white as she wanted. She wanted them like paper white. And I didn't catch that, so I remember that we had to speak to the lab, and they had to do a couple of things which I think they'd never done before, but we managed to get them as white as she wanted. But yeah, I think consent is everything. Just get and then yeah, it's not always easy to know
Yeah.
exactly what's in the patient's head, but yeah, I think
So
communication.
how did you overcome that then for future patients in terms of figuring out how white they want to go?
Yeah, I do kind of show them the shade guide, um, and I think that was a bit of an unusual case though, because
Hmm.
I think when she saw the shade guide, she thought it was going to be as white as she wanted, but I think she expected them to be brick white, like, and that's Tipex white. Like if you put Tipex on your teeth, she was happy. And that was a very unusual case, actually, I think. It is hard, I
Yeah.
think, to kind of know that someone wants that.
Yeah.
You
So
know,
how would you
so
say your so there's always the patient that you shouldn't really take on because they're going to be more trouble than it's worth.
yeah,
But what
yeah,
happens with
everyone's happy.
experience is you're able to take on more difficult cases. So what's been your relationship with patients who you say at this stage and where I'm at, actually, there's not a patient I want to treat. How's that been as you've grown in experience?
I think you get to, again, I think the consultation. So I do all my consultations for this reason as well. Um, you get to kind of know patients, that have false expectations, or like the patients that badmouth other dentists. Those are always one of the ones you need to be a bit wary of. But yeah, it's more if they don't align, if that if you don't think you can meet their expectations, and I think that's a good way to kind of know like which patients are right for you.
Yeah.
Is that sorry? Is that what you said? Is that your question?
Yeah,
Sorry, I think I missed.
it's trying to gauge that relationship between certain patients who you'd rather not treat. And I know that that can
Yeah,
change over time as you get more experienced and more comfortable
yeah.
handling difficult types of patients.
I mean, the difficult patients are like you do learn a lot from them, so it's kind of good in a way to get difficult patients. That's the way I see it now.
Yeah,
Because it's all part of the learning. I think you are like as life is. You get to understand things that work well, and when you get a patient that things don't go well with, gives you the opportunity to learn what you did wrong so that you don't repeat it. So I think it just makes you a better dentist um,
yeah,
in time. So I think everyone kind of needs, in a way, to have those bad experiences with patients.
yeah,
I think it's very rare for a dentist not to have a bad experience with a patient. I don't think this, I think that's how we all learn, you know,
yeah.
as is life.
So one thing I wanted to really get into was how you got to becoming an Apex provider.
Yeah.
But there's been some interesting things that we've been exploring, which I really wanted to allow time for. So,
Okay.
okay, you were doing 2 cases, then you were doing 10
Yes.
cases.
Yes.
What then changed for you to get to a place where you became an Apex provider and you're doing a lot of Invisalign cases? What was the change? What was the shift?
So I think when I got to the 10 patients, 10K, 10 patient mark, I then invested in an iTerra scanner. And I think for me, that was a changing point, because I did
As in
start to,
you bought it or you got the practice to buy it?
I bought it.
Oh wow, okay. So that's something in itself.
Yeah, it
What
was
why
like,
didn't the price of it put you off? Like how did you, you know, decide that this
I
was going to
think,
be worth it?
I don't know, I just thought, when I kind of looked into the tech, I just thought, I want one. Like, I don't care how, like, how it's going to happen, but it's going to happen, and somehow I'm going to get this iTerra scanner. And I remember they offered me a really good deal. I got it on finance, and I made the return on investment in 6 months. So it was definitely worthwhile.
Yeah, no,
um,
I'm just thinking about what you're saying there, and that's not a common thing. That's
no,
and I guess
no,
if you want to get unusual results and progress to that sort of level, you're gonna need to make
yeah,
or take action which is not normal. And someone saying
yeah,
I'm going to invest over 10,000, over 15,000 pounds
yeah,
on a scanner. That's people find it hard to invest in composite for their cases, and you're
yeah,
getting a scanner. Yeah, that's
yeah,
amazing.
yeah. And there's so many options. Like you can get the flex, and yeah, I would definitely say to any associates out there, do it. Get a scanner. It's there are so many options. You can get them on finance, but you do I found that you do get the return of investment back quite quickly. So I scanned all my patients. I don't now. It's something actually I want to work towards doing again. But I did scan all my patients, showed them all the outcome simulator, and I got so many patients in just with that. But for me, the biggest growth, I think, after the iTero was definitely word of mouth. I treat it, like I said earlier, every patient, I still do it now. I make sure every patient gets as best customer service as I can give them, and I really make sure the quality is as good as I can get it. And I think patients feel that, and when they really feel something or they're really happy with their results, they will tell other people about what they've had. And for me, that's been my growth really, and it's word of mouth. I did get Instagram, so I think near the time that I got the iTero scanner, I also started Instagram, and I posted the 10, I think one or two of the 10 cases that I did, and that I got good response from that on social media. But organically, I've not. I wouldn't say Instagram is like my main way of getting patients in. My Instagram isn't that huge. I've got, I think it's about 6 to 7,000 followers at the moment. Um, so I wouldn't say it's like my main port of call for patients at the moment. Um, but yeah, the word of mouth for me, for sure, has been my growth, and I think that's
Yeah.
how I've become an Apex provider.
Yeah, I'm trying to sort of like get some sort of summary on what makes you
Yeah.
as good as you are, and it feels like it's invest in yourself. you know
Yes.
um don't be afraid to step out of your comfort zone and do new things. Start aligner cases or buy a scanner, and ultimately the results will speak for themselves, and that will bring more cases to you. That's the vibe
Yeah.
that I get from hearing from you.
Yeah. Yeah. And confidence doesn't just come like that. Um, you have to work at it. And then once you get confident, you will want to do more and more and more, and you'll find a way to do more and more cases. And suddenly, like, nearly every patient will look like an Invisalign patient. You'll start to see certain things, like just the way their teeth are worn, and you'll
Yeah,
be more willing to, suggest it. So quite a lot of my patients, even if I just get like a checkup patient,
yeah,
I'll have some kind of conversation about Invisalign with them.
yeah,
So I think, yeah, definitely it's a confidence thing, but yeah, you have to have the courage as well to kind of build that confidence, and
yeah.
don't
And
be
if you do
intimidated by everything you see on social media, and all that. What you see, there's a lot of, I think on social media you just see the before and the after, but you don't see the process, and you don't see what people have done to get to that level as well. So I think
yeah,
very easy to see that and feel overwhelmed. Like if I saw that and just fixated on other people's results, I don't think I would grow. I would think I'd get overwhelmed, and I think I'd probably go into a shell. And I feel like there is a lot of pressure in a way because of social media, in a way, on young dentists out there. So yes, it's all their own journeys, and just to focus on themselves and their own growth. And as their confidence increases, patients will feel it, and then you'll develop yourself basically over time.
So do a great job for the patient that's right in front of you.
Yeah, definitely.
Build up your portfolio and your confidence that way, and more cases will come. There was a bit of a surreal moment where I was finishing I was coming to the finishing stages for one of my patients. So I like treating over 50s. They're my favorite patients to treat with Invisalign. Yeah. So this lady was probably in her 60s, and she was coming to the end stages of her treatment. So we're now going to reception to book her next appointment. No, sorry, I'm getting it wrong. So I was seeing a patient who was in her 60s, and she was considering whether Invisalign would be right for her because she wanted a bit of restorative treatment, and her dentist had referred her to say get ortho first. So she came to see me. So as we were finishing the conversation, I'd scanned her, showed her what the problem is with her occlusion at the moment and how ortho could improve that so she could have the restorative treatment. So as I was taking her to reception to book the next appointment, the next patient waiting to see me was a lady, Nina, who was coming to the end of her treatment. And also she was above 60. So
Yeah.
I was like, oh, Nina's here. Nina, how have you found the Invisalign treatment? And Nina was, giving me a glowing report there in the reception room. So it gets to a point where, as you're doing a good job for patients, they're going to be your marketing team. They're going to help you get other patients. And I just saw this lady yesterday, the one who Nina was talking to, and she's now finishing her Invisalign and no refinements needed. She's been great, and it's gone so quickly. So, I guess that's another thing about Invisalign. You get to know your patients really well because you see them quite a few times over months.
And she could relate to that, because I think with elder patients, they're always a bit like, oh, I'm too old, maybe it's not right for me. They're a bit more anxious. So yeah, I think definitely seeing another patient like her in the waiting room must have been like, and that's great for you because you like treating over 50. So maybe always have like one of your Invisalign patients after the consultation in the waiting room.
Yeah, I love, especially retired patients, because they are wearing those aligners 23 hours a day. They.
No, I do. I've got the odd sort of patient that's older, and they're usually very committed. They're just more grateful, I think. The elderly patients, I feel, not all. Like you get the younger generation as well, but I think I do notice a difference as well in the elder generation. They do wear them better, don't they?
They do 100%. I had young lady where treatment didn't go well, so it's ending very well in terms of how we've come to a conclusion. But she started off great, but I could tell that she wasn't wearing the aligners for as long as she needed to, and she was forthright with it, saying, I'm not wearing these for as long as I should be. And just through experience, I've realized it's just good to have that honest conversation to say that there's no point me continuing to do refinement after refinement if you're not going to wear them. It's just going to get worse and worse.
I've had a patient where he had a bit of a gag reflex, and he went through the first set of Invisalign, did quite well, and we because it was his wedding, his top teeth were in the right position. We did his bonding, and he just had minor lower crowding left. So we said, we'll do some more aligners. He just lost motivation after his wedding, didn't wear his aligners, and he was too, because we've got dental monitoring as well. So he just kind of went, he stopped doing the dental monitoring, he went off track. We tried to get in touch with him and everything, and he never really got back in touch. But when he came for his review, they'd gone worse. So they'd relapsed from where he was originally, and he said, I'm done with Invisalign. This is the exact words, like, I don't want to do it anymore. Happy with the way my teeth are. I'm not going to wear retainers, so let's just end this. Like, I don't want to. It was just so sick of like this. I made him get retainers. I said, look, you've paid for them. I'm making you retainers. If you wear them, it's up to you. So I said, look, your teeth, you've made this investment, your teeth are going to move. But I just thought, well, if I'd maybe, I kind of thought, have I missed something, at that stage? Should I have noticed that he wasn't going to wear them? So I was kind of looking back at that thinking, that kind of changed my view a little bit on refinements as well. Just maybe have that, I do have that conversation, but if they're showing any kind of apprehension, maybe like taking that on board instead of being like, it'll be fine, like you'll get through them and it's the best thing for you,
Yeah,
so it's
because
so important.
there is such a thing as a line of fatigue, and that's
Yeah.
something you pick up with experience, where you have to know your patient. Are they still as motivated to really go through refinements? Because we want to get that perfect Instagram shot alignment where there's no derotations, everything is aligned, but you can only do as much as your patient will allow you.
Absolutely. Yeah, 100%.
So I mean, at this stage, you're getting to see a lot of patients. How have you become more efficient? Because you'll start to get patients that are starting treatment, patients that are needing refinements, patients that are needing restorative because their alignment's finished, patients that are now needing retainers, patients for follow-ups, aftercare appointments, maybe. How do you start to handle all of these different stages that patients may be at the same time?
Yeah, so it's just handling the volume. How do you handle the volume of all the patients? And I think there's a lot of ways you can, especially with Invisalign. So one is that I use dental monitoring. So dental monitoring is like an AI system where patients scan their teeth every week, and it just means they don't have to come in every 4 weeks unless they need IPR. So it saves that appointment time. And so that's one way. And I also have found that we need a lot less refinements with dental monitoring. So it saves on that time as well, and patients are more motivated. And we're very strict as well with dental monitoring. So we say to patients, like, you have to, otherwise you'll have to come in every 4 weeks. And most patients then do all the scans. And then in terms of other ways, so my nurse is starting to do a lot of my scanning now for my patients. And that's another way we're starting to reduce my sort of chairside time. And we have got plans for the future where the treatment coordinator will do all the consultations. The nurse can even do the first fit if there's no IPR. That's something that and if there's no attachments, they fit the aligners, give the instructions, but don't have the attachments, don't have the IPR. And then all we do is have that 20-minute appointment for attachments, IPR, and again, that would save a lot of our treatment times. It's not something that we've actually implemented yet, but that's what we're looking to do. So there's loads of ways really, especially with Invisalign, that allows you to streamline your process. And I think in Manchester they were talking a lot about that, weren't they? Was it Sandeep? He was saying, Kumar, he mentioned a lot about that kind of reducing your chairside time. So yeah, that there are lab bills, but Invisalign really allows you to refine your chairside time, which is true. And I think the more cases you do, the more you start to feel like you do need that, and it is more profitable as well to work like that. So yes, it is hard. You know, I was at a stage where I was going home, doing my clin checks at home, and I was doing 6 days a week. But then I realised that, you know, it was getting a bit too much. So I then made the switch of like my Saturdays and just working more smartly, and it hasn't affected my, you know, how much I make, everything like that. So, you know, those are make your time more efficient.
Yeah. What would you say is something you're looking forward to going forwards, in terms of, you know, professional life? What would you say you're looking forward to?
So my future goals, I want to try sort of as an associate, maximize my potential as an associate as much as I can. So I would like to get to the point where I am fully delegating to the max. And I do like being an associate at the moment, just because I feel like I can leave my work at work and go home and not have to worry about it. I think times are changing, and being an associate is, I think, not, you know, having your own brand within, especially I work with my dentist, it's not as easy as it was, I find personally. So I don't know how that's going to progress over time. So maybe in time I might get my own practice. But my focus is definitely my family. They definitely are my priority, and I love my work as well. But it's just kind of, I don't want to take my time away from Arnie's childhood. So maybe when he's a little bit more independent, I might then start thinking about getting a practice, or it might happen sooner. God knows.
Sounds exciting. No, but I think you do such an amazing job with the cases that you put out, and just how you've gone about it. It just seems like it's just been an organic increase in development over time. Getting to meet you a few years ago as well, and yeah, I feel like you don't have to be the loudest person in the room, but you know, your work does the talking for you, and you know, it's just a joy to watch. So no, I continue to look at what you're doing and how you're doing it, getting some tips and things that I can implement into my own practice. But no, thank you very much for your time today. I've really appreciated it.
No, likewise. You're an amazing dentist, and this is my first time doing a podcast or anything like this, and you made me feel really comfortable. And the fact that you're doing something like this to help other dentists is really credible. So thank you for your time, and for giving me the opportunity to talk out to everybody.